Hi, my name is Melanie Clark. I'm from the Open Door Clinic in Middlebury.
I'm Rebecca Goldfinger-Fine. I'm the Executive Director at People's Health and Wellness Clinic in Barrie.
Hi, I'm Chris Schumi. I'm the Ladies First Coordinator for the Good Neighbor Health Clinic.
My name is Cindy Krautheim and I work at the Bennington Free Clinic.
We reach out to rural Vermonters in a number of ways. We go to local farms and we provide flu vaccines to them. It's our way of connecting with the farmers and the workers there.
We care for the very poorest in our community, and they seem to gravitate to us and seek our advice.
A lot of the time through word of mouth. Both from our patients, so patients who are already receiving services, we let folks know when we have a new program, and they often share that information with their networks.
We offer blood pressure readings sometimes at the community dinners. We attend all the different health fairs in our community.
In the past, we've also done outreach at all the libraries in each of the towns. So we've done kind of like a library cycle. And that way, any individual didn't have to travel more than maybe 10 minutes to get to any sort of informational sessions.
I'm a big person of the general stores. The general stores are the community of Vermont. That's what I've read and that's what I believe. And so I poster a lot.
I have put posters in businesses, you know, the larger businesses. And what I'm going to do next is, instead of asking to have them put on the bulletin boards, I'm going to ask that they put them in the ladies' rooms. For one thing, it's not so offensive to the men. The women don't have to talk about it in front of men. And plus, let's face it, once a day, everybody's got to hit the ladies' room. So.
We will meet with directors of our local homeless shelters or businesses to just talk about who we are, what we do, so they can put a name to a face and they can refer people on and say, yeah, we've met them, they're great people. They feel comfortable referring on to us.
The clinic is involved in various coalitions, so like Hunger Free Vermont. We're connected with a lot of awesome local organizations that are providing services to a lot of people who would be able to access free services from the clinic.
I have a great deal of faith in one-on-one, and if I can talk before a group and be open to questions, I feel that makes me more approachable.
We also work really closely with healthcare providers. So as people see individuals that might be coming into the urgent care center or the emergency room, they will refer individuals onto our organization, and when people come in to see us, if we can get them on health insurance, we also will refer them to their organizations for care through a primary care office.
So if we have like a new initiative or, you know, like seasonal flu shots, we're able to spread the word that way, and those folks can share with their networks as well.
We have a cancer center in our town, and I specifically went to the community organization called Cancer Crusaders. They are more attuned to what the patients need, like tires to get to Dartmouth, or car repair, or maybe a lady needs a special bra.
Our limitation sometimes is based on the fact that, you know, we have doctors that have clinics sometimes at certain times, and they come in right then and there. They want to be served, and we don't have a clinic going on. So, you know, what we do is just try to make sure the next time there's an opening that we'll fit them in. So we keep like a waiting list. You know, we just try to keep up with our community. I mean, of course, you always can do better, but, you know, we just feel that we're trying our best to make sure people are aware of the fact of Ladies First, the different programs we have at the clinic.
You know, a lot of the uninsured and underinsured patients that we see, when they're really in a bind, they end up at the emergency department or urgent care, which is often a costly trip for them. So trying to connect with the leaders and the staff of those facilities to make sure that they know that we exist and what sort of services we can provide for free to the uninsured and underinsured patients. And I think we are known in the Central Vermont community but often we are surprised by people who are still like, oh, wait, there's a free clinic like right down the street. So I think it's just continuing to try to get involved in all of the conversations that are happening about, healthcare and dental care and health insurance.